Welcome to the MAC Aquatics team. The following instructional video details the MAC-specific spinal backboarding procedures for rescues in both shallow and deep water. In the event of any emergency requiring EMS, guards should first activate the EAP. Specific EAP procedures are detailed in our Aquatics EAP training video. The MAC backboarding procedures have been adapted to meet the unique needs of the facility. MAC is a unique facility in that there is typically only one lifeguard on the deck. During busy programming and peak times, there are often other staff, all trained in CPR, that can assist you in the event of an emergency. Lifeguards train often in these procedures to become efficient and capable of teaching a bystander the necessary steps to assist during a spinal injury. It is your responsibility as the primary lifeguard to direct secondary responders to perform as you need them to perform. Communication is crucial during this rescue. If your secondary rescuer is not a lifeguard, you need to clearly communicate specific holds and procedures in the process of backboarding your victim. Remember to communicate with your victim. Only ask open-ended questions to your victim. Do not ask yes or no questions, as your victim may shake their head out of habit, compromising inline stabilization. Clear communication with your victim is important to keep them calm and to help you assess for their level of consciousness. If your victim becomes unresponsive at any time, they should be rapidly extracted from the water. Step 1. Activate the Emergency Action Plan.
To activate the emergency action plan, the primary rescuer will blow one whistle blast, press the red emergency button on the radio for 4 seconds, then hold the push to talk button and say their location 3 times.
Step 2. Proper entry into the water.
If you suspect a spinal, use a slide-in entry. From here on out, your movements as a rescuer need to make as little waves as possible to prevent further injury. If at any point during the rescue your victim goes unconscious, pull them out of the water immediately. We consider life over limb.
Step 3. Manual inline stabilization.
As primary responder, remember your duty while the victim is still in the water will be to open and maintain their airway while providing inline stabilization. When using the head splint support, be sure your hands are positioned between the victim's shoulders and elbows. Their head should be tightly secured between their arms. If the backboard is not ready to be submerged, hold your victim in this position perpendicular to the wall about 10 feet away from the edge. Do not circle your victim. This is a good time to get more information from your victim to pass along to EMS when they arrive. Under special circumstances, you will need to use the cheek and chest support to perform inline stabilization.
Step 4. Submerge and position the backboard.
As secondary responder, wait for the lifeguard's cue, then slide the board along the bottom of the pool until the head of the board can be completely submerged. Done correctly, you will submerge your arms and the head of the board to your elbows. The board will ideally float up slowly and level. Your goal is to control the board and help make sure the victim's head is directly on top of the black Velcro pad. The lifeguard will help to guide the board with his or her foot, but be sure to minimize any jarring motions. If the victim's head is resting on your arm, you will have to rotate your elbow before the victim is completely on the board so their head, neck, and back can remain in line. It is helpful to have an open hand pressing against their arm to perform this.
Step 5. Transferring inline stabilization.
As you are transferring inline stabilization, clear communication with your other rescuer is key. The secondary rescuer will first take over the head splint. The primary responder will then use the head and cheekbone support as the secondary responder lowers the victim's arms down by the victim's side. Once the secondary responder begins holding the victim's head in line again, he will not let go until backboarding is complete and ready for extraction.
Step 6. Sizing and securing the C-collar.
To adjust the C-collar, pop out the locks on either side. You can do this by flipping over the C-collar and pressing on the locks firmly. Change the height to fit the length of the victim's neck, and be sure to pop the locks back into place before positioning the C-collar on your victim. You will hear a snap. To determine the proper size, use your fingers to measure from the top of the victim's shoulder to the bottom of their chin. To assure the C-collar is secure and on correctly, put it on while standing to the victim's left. It may be helpful to put the C-collar on in a U motion. While sliding the flat portion of the collar under the victim's neck, push it at an angle to take advantage of the space between the victim's shoulder blades. Be sure to prevent any movement of the head or neck while you are securing the C-collar in place. The victim's chin should fit snugly into the center of the chin rest to prevent any change in head position.
Step 7. Strapping the victim to the backboard.
If the victim is high enough on the board, the first strap should be at about armpit level. Secure this strap under the victim's arms and tightly across their chest. Work your way down the board, loosely securing the victim's hands under the second strap and tightly securing their legs under the third strap. Keep in mind that the victim's height will determine where the straps lie on their body. Be mindful of their comfort, but be sure their straps are secure enough that there is no movement during or after the backboarding process. If the victim is too low on the board, you can use the cross strap technique. To do this, you will put the first strap over the victim's shoulders and across their chest. Use the second strap under the victim's arms and tightly Velcro to the first strap on the opposite side to create an X across the victim's chest. After you Velcro each strap, be sure to double check and assure that they are tight. If a strap is too loose, undo it halfway. Pull the bottom strap until it is tight and then re-adhere the straps together. It is okay if there's a kink in the straps.
Step 8. Securing the head immobilizers.
The primary responder should place both head immobilizers at the same time. On their count of 3, the secondary responder will flare their hands out of the way. Once the head immobilizers are in place, the secondary responder will reposition their hands until the forehead strap is secured across the victim's brow. In the deep end, the primary rescuer should secure the head immobilizers from the deck.
Step 9. Removing the victim from the water.
After the victim is securely strapped to the backboard, the primary rescuer will position themselves at the foot of the board if in the shallow end. On the primary responder's count of 3, pull the backboard out of the water at a slow and steady pace while keeping the board low to the ground. Be careful as you set the board on the deck and keep in mind that the victim's legs should not be suspended over the edge of the pool. If in the deep end, both responders should be at the head of the board pulling the backboard.
Step 10. Perform secondary assessment.
After you have removed the victim from the water, monitor their level of consciousness and breathing, comfort them with towels, oxygen, and reassurance, and convey everything to EMS and your supervisor.